Nearly 400,000 babies are born each day worldwide according to the United Nations. The COVID-19 pandemic is not stopping women from continuing to have them. Some tell us that they were already expecting or had plans to have them before the COVID global crisis erupted. However, others worry about how the decisions to have a child may affect mother and baby, as the current time proves to have some worrisome health and economic challenges. So what does research say about pregnancies and the coronavirus? We explore this and more coming up on today's episode. Hello, I am Orion Itangishaka. Welcome to Our Voices. On this episode, we discuss maternal health during a pandemic. Doctors know that viruses can affect pregnant women and their developing fetuses, and now they are scrambling to understand the effect of COVID-19 on pregnancies. Carol Pearson explains.
When a woman is pregnant, her immune system changes to protect her growing baby. But these changes make her more vulnerable to certain viruses, such as the flu, and increase her risk of serious health problems. So far, studies about pregnant women infected with the new coronavirus show both reassuring and alarming results.
They had increased hospitalization, and they had increased ICU admission, and they had increased receipt of mechanical ventilation when they compared them to women of the same reproductive age with COVID-19 that were not pregnant.
Doctors are trying to determine if COVID-19 is more dangerous for pregnant women than getting the flu. Yet the Centers for Disease Control and Prevention says pregnant women who get COVID-19 and are hospitalized have higher rates of serious illnesses, are more likely to have miscarriages, deliver babies prematurely, and more likely to have stillborn babies. Other studies contradict these results.
Since COVID-19 is so new, we don't have all of the data that we really need to make an assessment as to what level of risk it imparts on a pregnant woman.
For example, could stress be a factor? Pandemic-related hurdles to prenatal care, like lockdowns, prevented some women from getting checkups.
Take a breath and go right back at it.
Or even getting medical care when giving birth. Some women put off seeing their doctors out of fear of getting the coronavirus.
Prenatal care, particularly in the third trimester, is one of the ways that we ensure both mother's health and ensure that there aren't stillbirths.
Until more is known, pregnant women need to protect themselves from the coronavirus by wearing face masks, social distancing, avoiding crowds, and practicing good hand hygiene. Doctors say women also need to call their physician if they notice decreased fetal movement.